Hi everyone. In today's clip, I will talk a little bit about chronic obstructive pulmonary disease or COPD. Just a reminder that anything I post here is not meant to diagnose or cure anything and are for informational use only. For any health-related matters, please make sure to consult your healthcare provider. COPD is a chronic lung disease that makes it difficult to breathe. It's caused by a number of factors, including smoking, air pollution, and exposure to dust and fumes. In people with COPD, the lungs can get damaged or clogged with phlegm. Symptoms can bring things like cough, sometimes with phlegm, difficulty breathing, wheezing, or tiredness. Smoking and air pollution are the most common causes of COPD. People with this ailment are normally at higher risk of other health problems. Given that modern medicine has not come up with a cure for this ailment, there's a lot that can be done still naturally to stop progression of this issue. Medications for COPD include bronchodilators, inhaled steroids, and even antibiotics. So short-term bronchodilators are used when we need them, like during intense breathing difficulties, and some brand names are like ProAir, Ventolin, Proventil, and a whole lot more. Then we have the long-acting bronchodilators, which are taken regularly and are used when the symptoms are regular or flare-ups happen often. Examples include salmeterol or formoterol or indacterol, and so on. Then we have combination bronchodilators, which are inhalers that contain more than one bronchodilator or bronchodilator and a steroid mix. And we have inhaled steroids, and these can sort of lessen airway inflammation and help prevent flare-ups. And of course, antibiotics, and that's used to treat flare-ups, especially if mucus production has increased or changed its color. On the more natural side of healing, we can use supplements like vitamin D. This can help the lung function better and protect against the flare-ups. Your healthcare provider may ask you even to take high doses for a short amount of time, like 50,000 international units a week for 8 weeks. And then we have my beloved vitamin C, because low levels of vitamin C are linked to increased shortness of breath, mucus, and wheezing. Vitamin C supplements reduce oxidative damage on the lungs, which can help prevent the development of COPD. Again, this needs to be in high doses. I will do a clip on vitamin C on its own after this to explain the uses and needs for this vitamin. Then there's magnesium sulfate, which improves lung function and makes breathing easier. So your doctor may ask for up to 2 grams delivered over 20 minutes through IV, or 1 to 3 grams orally on a daily basis. And then there is omega-3 fatty acids that also help improve lung function and make the breathing easier. Of course, lifestyle changes, eat more fruits and vegetables. These foods are anti-inflammatory and delay the progression of COPD. Exercise regularly, because regular physical activity improves overall strength and endurance. Other remedies such as acupuncture, massage, yoga, essential oils like lavender, gardenia, eucalyptus, and orange are all helpful to manage this ailment. On the spiritual side of this ailment, the lungs are the organs that are most connected to the emotion of grief. The lungs interact with the outside world, breathing it in and letting it go. When we do not let go of our grief, it's almost as if it can fester in the lungs, causing congestion and exhaustion. Grief can be about death, breakup, moving to a new city, or a big life event or big life change, even if the change is positive. imagine having a baby, for example. That's supposed to be an amazing event, but it does mean you're losing your identity that you had before becoming a parent. All these griefs and more deserve a gentle attention and care. Now, grief itself is also generally hard on the body. Processing a loss can be exhausting. And even when we give ourselves the time and space to grieve properly, we are fundamentally more vulnerable to common coughs and colds. It's important to acknowledge that our grief, it's important to acknowledge our grief and give ourselves time to rest and feel our feelings. It's uncomfortable to do this, so many of us sort of skip over this and try to distract or busy ourselves and get our minds off of our griefs. When we don't give ourselves enough time to deal with this and come face to face and deal with it, the body will often make us sick so that we can take the time as we need and actually deal with it. Now, in order to care for the lungs physically and spiritually, practice breathing deeply and ensure that you're giving yourself the rest your body requires and needs. Keep your body warm, especially in cooler weather or colder weather, or windier fall and winter season. Spend some gentle, loving time with yourself and consider adopting a ritual or talking to a friend or a counselor or however else you may be feeling the release. Hope this has been helpful. Like and follow for more. Be the light.